Representative Pine,
Yes, in opposition, and I'll say a few words.
please proceed.
What this bill does was, or the intent of it was, to provide health insurance coverage to children who are uninsured or not eligible for the state's MedQuest programs. How do you not vote yes to override this bill? It's a very difficult one, because who would not want to insure uninsured children in Hawaii? And it's unfortunate that politics has kind of come down to passing bills by soundbite. But I'd like to explain why I want to vote against overriding this bill today. This is the same bill that I've always supported since its inception. But today, I think, reading the governor's message, she made some very compelling points. When we first passed this act in 2007, there was a study done in April of 2008, just to see how we're doing. Are we really reaching that targeted group of insuring the uninsured children that don't qualify for our programs? And these are the results of it. 95% of the 1,804 children enrolled were already previously insured by their own families through HMSA's Children's Plan. So the state thought we'd check it out again and see if we made any improvements. Are we really, truly targeting the children that's in our hearts today? So in August of 2008, the enrollment grew to 2,201, but only 300 of the children enrolled were truly the ones that we had passed this law for. And as the governor explains in a veto message, even with these concerns, the new measure does not deal with this problem. What's happening is people are soaking up the taxpayers' money that don't need the help that we intended this bill for. Only 300 of those kids were the ones that were in our hearts when we passed this bill. And people who can afford health insurance or were already paying for their health insurance switched over so they don't have to pay it anymore. And so the problem I have is as we're in this budget crunch and we're trying to look at ways to make government more efficient and more accountable to the taxpayer, are we truly allowing a bill to become law that targets those 300 kids that we care most about? And the problem with this bill as well is we're only allocating $200,000. So once we reach that gap, what if there's more than 300 kids, the ones we're really thinking about in our hearts, that need that health insurance, that steps forward after we hit the 200,000? The state is going to have to say, I'm sorry. Even though you are the most needy, and even though 95% of the people that we're helping don't really need the help, I'm sorry we reached our limit. And so I deeply apologize to anyone that's offended because I've always supported Keiki Care, but I think we just didn't do it right just this time. Let's just try one more time to reach those 300 kids that we really care about.
Thank you very much.